think most men are truly aware that this happens. People joke about it.
Joking about male menopause, Health Check's CHRISTI Myers takes a closer look at what men need to know about the symptoms. Well, you usually think about middle-aged moms dealing with menopause, but it affects men as well as women.
Tonight, Health Check's CHRISTI Myers has some surprising information about the symptoms of male menopause. She takes a closer look and explains why men don't have to suffer in silence.
Panels, the solar panels, no damaged panels at all.
This is astronaut Bill Fisher on a spacewalk repairing a satellite.
I'm going to be able to get it again here. Watch out, get me down. Get me down.
And then you're going to get serial.
And this is Dr. Bill Fisher, emergency physician at Busy Memorial Hermann.
I may have to keep you in the hospital.
In between shifts, he's training to climb Mount Rainier.
Knowing I have to be in shape to do this or I will fail, that helps push me along. I think I need that.
So it may be a surprise to learn this 61-year-old man's man has been going through male menopause.
I think most men are truly aware that this happens. People joke about it.
But it's for real. In their 40s, a man's testosterone can start dropping at the rate of 1% a year.
So it's not noticeable. It sort of sneaks up on you.
The symptoms will sound familiar. Drop in energy, weight gain, especially the spare tire, loss of muscle mass, depression, irritability, decreased sex drive.
Overall enthusiasm and passion for work was down. I just didn't have the want to. It just kind of had faded away, and I knew something was going on.
Steve LAZZARA had the symptoms, and so did his doctor.
I was different, and I was also gaining weight in the wrong places, right in the middle of my gut.
I think they assume it's just I'm getting old.
How can you tell if it's just getting old or a drop in testosterone? It's a simple blood test. Steve's level was low, and he started getting testosterone replacement. Now 62, he has more energy, has started a new business, and says the depression is gone.
It was like a weight had been lifted off my shoulders. It was a tremendous change.
Dr. Fisher has a testosterone patch.
Say it took about a week before I could feel a difference. And over about 6 months, the problem with weight went away.
Doctors recommend taking testosterone as a cream, gel, or patch, which can be absorbed through the skin. And
if the dose is correct, there should be no negative side effects.
But they're talking testosterone replacement, getting back to normal, nothing more.
This is not taken for bodybuilding, and this is not for people who have normal levels.
But when you get the level right, a man can see more muscle and
a little decline in the body fat, frequently around the waist. Another little benefit they've shown is that people who are type 2 diabetics, it helps with glucose control.
Of course, the sexual aspects are there also.
And there's the grouchy old man kind of prototype or stereotype.
That too can go away.
They feel better about themselves, they have better self-esteem, they have a better outlook.
So it's made a big difference in my life.
But many men don't know about it.
This is basic stuff. It's just that usually the family doctors and the people doing your physicals aren't checking for things like testosterone.
I'm going to pitch it up a little bit. Okay.
The astronaut doctor recommends.
Let your doctor check it, take a look at it. What have they got to lose?
CHRISTI Myers, 13, Health Check.
And we have a list of symptoms on our website. If you have 4 or more of them, you may have testosterone deficiency, or it may be another medical problem that you should have checked by a doctor. Just go to abc13.com to see those symptoms.